Good afternoon. I would like to introduce myself. My name is Bambang Sugiyono Agus Purwono. I am a lecturer in State Polytechnic of Malang, Indonesia. And our paper title is National Strategy to Combat COVID-19. Ladies and gentlemen, this paper will be presented in third London International Conference (LIC) on 3rd till 5th of June 2021. The theme is the new normal, challenges on education and social sciences. The outline is introduction, literature study, strategic planning, conclusion, references, and biodata. The first is introduction. As you know, the President Republic of Indonesia, Jokowi, finally declared a COVID-19 public health emergency on March 21, 2020. 1 month after the first 2 cases in the country were confirmed in the 2nd of March 2020. The mothers and her daughters who suspects COVID-19. The President have issued Government Regulation number 21/2020 on large-scale social distancing as an implementation regulation of the 2018 health quarantine law to restrict the movement of people and goods within a control zone, but is stopped short of allowing regional administration to close their border. And the President Jokowi has also decided not to ban the mass exodus from a big city to her mother city on Idul Fitri on Eid, although he has advised people not to mudik. The traveling people is more than 30 million people. They travel from one city or some city, many city to another city, another islands. That's very, very dangerous consequence or impact. The first is issue of the government regulation, large-scale social restriction. There have 3 include the closure of school and workplace from the elementary school until higher education. The lectures has been closed. Number 2, the restriction on religious activity. Every citizen now is not get a religion activity using offline, but the government suggests to get religion activity using live streamings or online activity. Number 3 is restriction on activity in public places. Many of supermarkets and mall already monitored by task force. The large-scale social restriction is stimulated in the health quarantine law, namely, there are home quarantines. It means the involvement of the people, of the citizen, Indonesian citizen, should help the government to help to set up the home quarantines, and the government prepared the hospital quarantines. Number three, the regional quarantines. This is the little strategy of the strategic planning. There are 8 steps designing of strategic planning from the vision, mission, objective, strategy, policy, program, budget, and procedure. What is the meaning of vision? Vision is to realize the impossible dream, and mission is the to operationalize the vision, and objective is transformation of the characteristic, and strategy is the way to carry out the action and the activity, and then policy is the guideline to carry out the action and activity, and then the program is carry out the action and activity. Also, budget is cost to carry out the action and activity, and the procedure, the sequence of steps needed to do the action activity. I use the research approach. The research approach is qualitative or subjective approach using secondary data. Now we would like to explain about the strategy planning of the national strategy to combat COVID-19. Vision. The vision of the national strategy is national strategy to end COVID-19 in 2022. And the mission is everyone participate in reducing the number by practicing the 3M health protocol. The first is mask wearing. Every citizen should wear mask. Number two, hand washing. Then everyone try to wash his or her hand minimum 20 seconds. And number three is social distancing or physical distancing. Minimum the distance is 2 meters. And the objective of this national strategy is to reduce the number of suspect COVID-19. Number two, to eliminate the number of suspect COVID-19. And number C, to socialize the pandemic of suspected COVID-19. Number four, to prepare the vaccine till 460 million doses, and to inoculate the vaccine till 2022 with priority. And the strategy is national Indonesian strategy. It means strategy to combat COVID-19 in 2022. And the program is number one, to prepare for the situation get significant worse. And number two, the president has issued government regulation number 23 2020 on large-scale social distancing. Large-scale social restriction include number one, to closure of the school and workplace. Number two, restriction in religious activity. Number three, restriction on activity in public places. Number four, restriction stipulated in the health quarantine law, namely home quarantines, hospital quarantine, regional quarantine. Number three, the government has issued government regulation number 23, imply a heavy-handed security approach. Number four, President has also decided not to ban the mudik mass exodus on Eid Fitri, the long holiday on religious holiday, although he has advised people not to mudik. The budget, the government has issued Purpo Government Regulation of Law number 1 2020 on state financial policy and financial system stability, refocusing state expenditure of 405.1 trillion. This is equivalent with 19 billion US dollar on number one, the health sector, and number two, social welfare safety net and tax incentive. The procedure of national strategy is number one is every hospital will be required to treat COVID-19 patient in according with the Health Ministry official standard operating procedure to ensure an optimal recovery rate. Number two, uniform treatment of COVID-19 patient would be mandatory in intensive care unit, ICU, isolation wards, and quarantine facility. Number three, to begin mass vaccination scheme as early as possible to ensure smooth sailing on two proven vaccine has was and available for widespread use. Number four, multiple mini lockdown will prove to be more effective. The conclusion of this paper is number one, this pandemic disease is not a simple to be solved. It means every citizen should involve and aware, also try to help him or herself to recover from this situation. Number two, the task force should be the same command or we have unity of command or standard operating procedure. Number three, everyone want to solve, to combat, and to end the COVID-19 at the end of the year 2022. Sayonara COVID-19. Thank you very much for your attention and appreciation. See you later in the next international conference. Bambang Sugiyono, State Polytechnic of Malang, Indonesia.